afternoon. I'm Anisha Nayar Dhawan, and I am proud to welcome you to this session of Gratitude Week from 1st to 7th July. This is an initiative of the Health and Wellbeing Council to bring everyone together to say a heartfelt thank you to our doctors, nurses, and our entire healthcare ecosystem celebrating National Doctors Day on July 1. This is a Thanksgiving marathon, and it is our endeavor to thank our healthcare heroes for a whole week and carry this gratitude in our hearts forever. Not just today, not for a week, but forever. Now, superheroes don't always wear capes. Sometimes they wear gloves and aprons and save us in our hard times. I'm talking about doctors who have toiled hard over a year to save us from the COVID-19 pandemic, putting in endless hours and sleepless nights to ensure that patients are cared for and recover from their illness. While we have seen our healthcare facilities overwhelmed during the recent second wave of the pandemic, doctors have also relentlessly been caring for patients with chronic diseases like cancer. And today, in this session, we are going to say thank you to the special oncologists who are joining us and all the oncologists in our country that continue to work tirelessly to serve their patients, to treat their patients, to help them recover at a time when there's so much more happening, at a time when we're dealing with a pandemic as well. Now, Cytecare Cancer Hospital is a super specialty cancer hospital in Bangalore that left no stone unturned to ensure that cancer patients get consultation, treatment, and timely care during the pandemic. Today, Cytecare is counted amongst the best in India for its highly specialized modern diagnostic services, including advanced surgeries, medical oncology and immunotherapy, radiation therapy, and advanced diagnostics. Now, not only has the Cytecare Hospital done their bit during the pandemic of treating their patients, they have also chipped in to help the community at large. And a bit to help the local community during the recent second wave where beds were hard to find, Cytecare developed a 120-bed COVID-19 treatment center by converting a school's hostel into a step-down hospital with each bed equipped with a dedicated oxygen concentrator. An integrated oncology and palliative care center, Cytecare is also running awareness campaigns with some schools to raise awareness about pediatric cancer, and also they are running vaccination camps to ensure that all of us are safe at the time of a pandemic and we are able to mount the best defense that our body can. Now, today, we are very privileged to have amongst the most senior doctors of Cytecare Hospital joining us. And first off, I want to thank all the doctors who are joining us today for sparing the time and for doing such a wonderful job in such tough conditions. So please welcome the top oncologists and the CEO of the company who are joining us to talk about caring about cancer patients during tough times of a pandemic. Please welcome Mr. Suresh Ramu, the co-founder and the CEO of Cytecare Hospitals. Mr. Ramu is an alumnus of IIT Madras and IIM Kolkata, and he's also the co-founder of Site Space Research, a clinical research solution organization. We're also very happy to have with us Dr. Harish Menon, Senior Consultant and Director, Haemato Oncology, Director, Bone Marrow Transplant Program at Cytecare Hospital. He completed his DM Medical Oncology in AIIMS, New Delhi, and has worked at Tata Memorial Hospital for more than 2 decades. We're also happy to welcome Dr. Prasad Narayanan, Senior Consultant and Director, Medical Oncology, Solid Tumours. He completed his DM Medical Oncology at Tata Memorial Hospital, Mumbai, and also holds the ESMO certification in Medical Oncology. He has previously practiced in Dubai Hospital, Mazumdar Shaw Cancer Center, and Narayan Health City. And we're also very happy to welcome Dr. Harish B, Consultant Medical Oncology. After doing his DM Medical Oncology in AIIMS, New Delhi, he has practiced in AIIMS and PGIMR. Thank you all for joining us. It is indeed a pleasure and a privilege to welcome all of you, to learn from you, to understand how we can go ahead during the pandemic, not only taking care of those who have been affected by the virus, the coronavirus, but also those who have chronic diseases who also deserve to get a hearing, to get proper treatment, and get proper diagnosis as well. Thank you all for joining us. Mr. Ramu, let me start with you. Now, yours is a specialized cancer care hospital. Now, no other patients come here. Like if I have a heart disease, uh, I will not come to Cytecare because Cytecare only caters to cancer patients. Now, is a specialized cancer care hospital a safer option for cancer patients as opposed to multi-specialty hospitals where all types of patients are admitted for whatever problems they have? So, as a cancer patient, uh, am I safer in a specialized cancer care hospital at the time of a pandemic when I go for treatment?
Thank you very much for hosting us today. It is indeed a privilege. And I must say thank you to all the doctors in Cytecare as well as all over the world on the occasion of Doctors' Day. Um, COVID-19 changed a lot of matters that we had otherwise taken for granted. Hospitals are always prepared for emergencies, but this is something that I don't think anybody was really truly prepared for. A disaster of this magnitude and a duration that it has kind of endured had never been experienced ever before globally. Supply chains have been impacted, drug and material supplies was impacted, lack of transportation for patients, as well as our nurses and doctors impacted availability, staff becoming sick impacted services. So, as a cancer hospital and also a hospital that provides advanced surgeries, our focus has always been to ensure the safety of our patients. And as you know, cancer patients are immune suppressed, and that has been our topmost priority. So we had to do a lot of things. We had to upgrade our facilities. ICU facilities had to be upgraded. We had to change our waiting areas. We had to introduce newer waiting areas. For testing, we had to create separate bays. We had to change our visitor management policies. We had to train staff again and again on infection management, as well as managing patients and their families during these difficult times. So essentially, a whole host of operational processes had to be modified. And I think many of them, I would say, are best practices that have got introduced because of the pandemic. Sometimes adversity brings the best, as they say. But online video consultations, home care services, infection management, housekeeping, security, patient communication protocols, a lot of this had to be modified. Oxygen supply requirements were impacted, and our engineering teams had to work overtime to ensure supplies for the patients being treated, even regular cancer patients being treated who needed oxygen supplies, because the environment constrained the availability of a lot of these supplies. And we had to convince the regulators to say that a cancer hospital should not be converted into a COVID care center because we have immune suppressed patients. But above all, I must say thank you to all our doctors, senior and associate level alike. All of them jumped in willingly to support the patients, to take care of them, both the cancer patients, of course, and those who were infected. Because, I think they took their doctors, nurses, patient services teams, really took personal risks to take treatment of their patients. So what the hospital and the management did in these times is really very small in comparison to what the doctors have contributed. So I must say thank you to them. To your question about whether it is safer as is a cancer hospital safer, maybe I can defer and ask Dr. Prasad to take that question.
Thanks, Ramu. I think it's an interesting question that whether it is safer for a cancer patient to be in a dedicated cancer center. I think a dedicated cancer center definitely is the best option to get treated for cancer, regardless of whether there is a COVID pandemic or not, because cancer patients are different, their needs are different. It's a treatment where a patient goes through a journey. Actually, it is not just a transactional treatment like you go visit doctor once and then you take treatment and leave. So our patients keep coming to us for follow-ups for years together. So our patients' confidence in getting treated, they always want, once you have an oncologist who has treated you even 5 years back, you always want to see that doctor actually to take you through other issues as well. And COVID is no exception here. So they need us to give them confidence to say that it's fine, you will go through this. And then also to decide whether some ongoing treatment, some patients will be on follow-up medications on outpatient basis, whether those have to be continued and all that. So definitely a cancer center has to be the place where a cancer patient has to take treatment. And that is true during the pandemic also. Now, specifically, if you ask whether a cancer center is more, or an oncology setup is better for the taking care of patients. One thing about COVID is that it requires a lot of things which we even otherwise do in cancer patients, like avoiding a crowd, wearing a mask. In most other medical systems, I don't think that wearing a mask is something which we are used to. But in certain situations in cancer patients, we ensure that we wear mask, or the patient wears a mask. We see immunocompromised patients. We have the expertise in hand holding them through the tough time when the immunity is down. So it is nothing new to us actually. Even this the thing of the mucormycosis, actually it is something which other specialists have not seen as much as say cancer. As an oncology community we have seen. So all that makes a cancer center a better place maybe to get treated during this pandemic. And we have seen it in our experience here. As Ramu said, it was something which nobody was prepared to take, but definitely through the time, I mean, we all should see these things as an opportunity to learn new things. That is how science advances actually. So we all learned how certain things can be put in place so that we are better prepared to face such situations later. So I think the priorities on treatment, triaging the patients, continuing certain cancer treatments while the patient has got COVID. And for example, treatments like radiotherapy. A patient who is getting a curative intent treatment in radiotherapy, you can't stop the treatment because the patient got COVID. So the patients are treated even with COVID. We created a system where we could separate the other patients who come before, and then allocate a particular time for the COVID patients, the staff wearing PP, the patient wearing PP. So these are things which I think a dedicated cancer center can handle better than a multi-specialty.
All right. So the processes are such that a dedicated cancer hospital better serves the patients there. But Dr. Menon, what have you seen in your practice during this pandemic time? In terms of patient care, in terms of patient walk-ins, are people more scared even if they have cancer? They know they have cancer, but they're delaying their treatment. At least this is what we hear anecdotally. What have you seen in your practice?
So when we are actually, as both Narayan and Ramu said, this pandemic, we were never prepared for this kind of situation ever. And when it came back, we also had to understand what it is to be able to see whether it is more important to take care of the cancer patient on time, or whether you need to take care of the patients infected with COVID, because it never gave us any time during this period. But having said that, cancer is one of the second largest killers known to mankind. And if you don't deal with it in an appropriate time, it is naturally going to have its adverse impact in terms of life-threatening problems and taking away the life of the patient. So what happened initially was that because of the fear of COVID, there were a significant drop in patients coming in. But then when we got to grips with what the pandemic was all about, we started encouraging our patients to come forth for their treatment, trying to triage patients into those patients wherein treatment was necessary to be continued, for understanding those patients who could be managed remotely, like through a video consult or so, and also to understand those patients whom we could actually delay the treatment, because there are malignancies wherein if you wait for some time too, there's not going to be much of a difference in terms of implementing the treatment. So, but these decisions can be made only after due thought and consideration for that particular patient. So to organize these things, there were initially it took some time, not too long, but credit to everybody that we started moving forward in taking care of these patients. So in the first few months, or maybe if I say first 2-3 months, patients were reluctant to come to the hospital for treatment because of the fears naturally associated with COVID. But then once they realized that, once they got the confidence of what we were telling them about in terms of taking care of the treatment, they came forward. And I think even during the second wave, there was a drop, but it was not as much as we saw in the first time around. Still, patients came forward for their treatment during these times. So I think that is something that we have learned, and we are still learning as far as how to get patients treated. And for the kind of disease that I specifically deal with, which is Haemato-Oncology, there's no question of waiting for treatment many a time. You can afford to keep them under observation in some situations, but most of the time you need to get them treated because many of them can progress. And so what we have been successful is to take them through the treatment during these COVID times. And it's our advice that you get in touch with the treating physician, the oncologist, to take that call as to whether your treatment can be delayed or not.
Right. Dr. Harish, we heard Dr. Menon speak about, assessing how we can treat the cancer patient. Now, what can cancer patients themselves do to minimize their risk when they're seeking treatment?
Well, that's a nice question. See, as compared to general population, one thing we should understand is that cancer patients are not very different, which is usually the thought that cancer patients are supposed to be more isolated and sort of take more precautions and several other things. But what do we say? The general precautions for COVID, for the prevention of COVID, is exactly what is needed for the cancer patients as well. So we'll again come to the same thing, that frequent hand washing. Every frequent hand washing is a first and foremost thing, which is very, very important, so that any contaminant or touching the high risk areas are avoided. Frequent hand washing with the water and soap or with the hand rubs goes a long way in minimizing the risk of contracting COVID infection. And that is the first one. The second one is obviously wearing a mask. Wearing a mask is not only when we are interacting with other people. Wearing a mask even when we are alone in a room where multiple people have come and gone, where many people would have generated aerosols. So what we do is, when there are no people around, we just remove our mask and we become complacent in such a time. So it is that time where which is very, very important. So masking has to be strictly enforced, especially when they are indoors where there is high risk of contracting COVID, and other things like social distancing, which everyone else is doing, avoiding touching hands, nose, and mouth as frequently. So, and cleaning high touch surfaces like the doors of the door handles, the entrance ways, cleaning them more often, and according to other patients also, avoiding unnecessary travel and outdoor activities, travels. These are all general guidelines, which is applicable for all the general population, is also applicable for cancer patients. I don't think there is anything else extra needs to be done to minimize the risk. It's the same as for the general population.
You're muted, Anisha.
Yes. So like Mr. Ramu highlighted for us, that cancer patients are immune compromised. So Dr. Prasad, what steps have you taken at Cytecare to protect patients from contracting the virus?
So it is not easy to say all the steps actually. So we all learn with time. The first way was to just realize that we had to do something. and then it was about how we should go about it. So there were all the guidelines for management of cancer patients was where they were changing actually. As a cancer center, we are also part of the National Cancer Grid, which actually binds all the cancer centers in India together, and we framed guidelines, and we thought that certain things have to be done in a certain manner. That got evolved with time. I mean, initially it was about trying to, maybe there should be postponement of certain treatments, but then immediately we realized that this is not something which is possible in a cancer setup. Also, the operational changes which Ramu said were very important actually, and for that there were contributions from the clinical team, of course, actually changing the isolation facility. We needed to have an isolation facility for holding the patient initially till the results came, and then an isolation facility to admit those patients. Also, most importantly, you can understand the importance of this pandemic when the government brought a law which to determine how a teleconsult can be done, which is something remarkable from Indian scenario. So the teleconsults helped us a long way actually. Majority of the patients with the COVID, regardless of whether they have cancer or not, could be managed at a home facility. All these things we learned in the first wave, I would say. So we stepped up our teleconsultation facilities. We had our physician team, and we have a cloud physician team who take care of the intensive care patients. So we intensified the remote monitoring which we could do, and to reach out to more people that way actually. Also to help our patients gain the confidence that coming to the hospital for a necessary treatment has to be done. That was also primarily important for us, and to maintain our own staff's health, because once the healthcare workers get affected, then we are not able to treat the necessary the patients. So certain things which we did was that we had a way of half of the doctors team rotating in a group. It's like a bio bubble. It is not a real bio bubble, but still it is like we don't meet each other. I may not have met my colleague for maybe 2 months or so at one time, because we try to schedule in such a way that we alternate, so that even if one of the staff member gets infected, we are not out of service. The patients have to get their treatment. So that is something which we did really well, and without any delay or any patient care being affected. Another thing was, of course, the hospital. We beefed up the hygiene systems which we had. The infection control was much more active than the usual times. So almost all the patients, I think all the setup was as if we are treating a very low blood count situation patient actually. So the patient care became at a higher level, and I think in that way we could manage most of the patients and deliver most of the services. And another thing was to motivate. By the time the vaccination came, it was more important for us to be a role model. First of all, to take the vaccine first. The healthcare workers, almost 90%, I think, of our hospital got vaccinated immediately. Actually, in the first when the first batch came itself, and we are the full team of healthcare workers in the hospital, including the outsourced work people who work here. Everybody got vaccinated. That was the primary step. That gave the confidence for our patients to get vaccinated. Initially there was no guideline to how to vaccinate a cancer patient, but that also was an evolving thing. And once we had this confirmation that we can vaccinate them, we went on an education. Patients were educated that you should get the vaccine done. There was vaccine hesitancy in the beginning, which we tried to overcome by helping them. And more importantly, another thing was to give confidence to patients who got infected with COVID. As I said, many of them could be treated at home. We connected with them. We have we have a team of people who are cancer survivors who work with us actually. We call them patient navigators actually. So they connected with these patients and then motivated them, told them about the safety, and that most of you will recall, patients will get scared. So all that were stepwise things which we did. And as Dr. Harish said, by the time the second wave hit, I think though the number of COVID patients were more, I think we were much more equipped to handle the situation, and the numbers did not drop in the hospital in terms of patients seeking treatment. But we, as Dr. Harish said, we saw a kind of stage migration where patients will not come to the hospital in the initial phase thinking that there is some problem. And I think that impact will be seen in the years to come when globally or in the country we will see many patients who have not come to a hospital to seek cancer treatment during this year, during the pandemic.
Mhm. Uh, Mr. Ramu, we've heard the doctors, talk about how they've handled their patients, what systems are in place. Now, you spoke about, the doctor mentioned that when it comes to teleconsultation, the government came out with guidelines. Now, what were the unique challenges that your hospital faced during this time, and how did you navigate them?
Well, yeah, I think the attitudes changed pretty rapidly after the initial hiccups, I would say, because people didn't know how long this is going to last. And I'm talking about the first wave specifically. And we already had a video consultation platform, but it was rarely being used. Neither the patients nor the doctors were as comfortable or to utilize a platform, especially because I think you can do a lot more when you actually meet patients and their family members to assess the level of the disease. But very rapidly, I think we saw the patients adapting to it and caregivers adapting to it, and there was no really other choice. So the online platform that we had got immediately absorbed. But as has been mentioned, I think as a cancer hospital, we had to keep the infection out, and we had to figure out ways in which we keep our patients safer than before. So our patient services teams, our nurses team are already used to looking at cancer patients, had to further intensify their infection control practices. Our housekeeping and other practices had to be upgraded. So I think it was, in relative terms, as Dr. Prasad mentioned, a minor upgrade as compared to many other multi-specialty hospitals in terms of what they had to do, because our many of our practices were already at the level that you would expect to in terms of safety for patients.
All right. Any regulatory changes or from the municipality? Were there any, you said that, you were lucky that your hospital is not converted into a COVID center because you need to serve the cancer patients. But, you're yourself doing things on your own for COVID patients other than cancer patients. We talk about that. But any regulatory discussions, any SOPs that was set up for your hospital during the pandemic time?
I think the regulators, particularly on the ground, I would say the BBMP teams, the zonal officers who inspected the hospital and understood that we are an advanced surgical care hospital, were really kind enough to say that we understand fully that you cannot take COVID patients. So cancer patients who are COVID positive, we had to create some isolation wards and take that capacity. But we got tremendous support from the local authorities in that regard. They were under enormous pressure, obviously, to add the amount of capacity that Bangalore had to take on COVID patients. But they really understood that we need specialized facilities like Cytecare that are focused on these vulnerable cancer patients. So I think it was very, very well supported. A lot of the practices that have been talked about, for example, training, we already had a learning management system and online training. And a lot of our trainings were being video recorded. But because of COVID, all of that got accelerated even more so. So nurses training programs or even housekeeping training programs are all online right now, all recorded and available for posterity. So in many ways, I think, these are opportunities because a lot of the repeated costs of training or the time for training has been optimized. I think this is something that we have taken up as an opportunity to improve some of our processes.
Mm-hmm. Right. Now, cancers, of course, are of different types. You have the solid cancers and the blood cancer variety. So, Dr. Menon, what to understand from you, since you're a hematologist, how different is the treatment of blood cancer patients, and what have been the challenges in treating them during the last, during the pandemic, are they more susceptible to COVID, and the repercussions, are they more severe?
It's, I mean, in terms of, I'll just answer the second question. In terms of susceptibility, everybody is susceptible. Just because you have cancer doesn't make you more susceptible to COVID infection. But the ramifications post-COVID infections are far greater for a cancer patients because their ability to mount an immune response to tackle and reduce the duration of the illness and reduce complications may be a little more blunted than the normal population. Yeah. So, and that is, again, if you want to, if it comes down to differentiating between solid tumors and hematological malignancies, we would consider that the solid tumor patients are a little better off than hematological malignancies at baseline in terms of the immune constitution or their ability to fight an infection. But they get a little bit more blurred as the treatment progresses because chemotherapy itself can induce a certain degree of immune suppression. Now, it is very well established from data that has been published from several centers across the world that should a patient of a hematological malignancy develop COVID infection, their rates of complications may be far more. And there is as high as a 30% mortality rate associated with COVID infection in these patients. Now, so that is definitely going to be there. So again, I reiterate, it is just not they're more susceptible. No, I wouldn't say that they're more susceptible, but they are as susceptible as or as low susceptible as the general population. But once they get the COVID infection, perhaps they are at on the wrong end of the stick as far as that is concerned. Yeah. So and the other problems that we do encounter with hematological malignancy is in terms of what they can, how well they can mount a antibody response to a vaccination schedule, for example. There are most of the hematological malignancies emerge in the background of a compromised immune system. So, so intrinsically, they have one may call it like a paralyzed immune system to a certain extent. And so when these patients are vaccinated in several ways, they may not mount as good a response in terms of antibodies as the non-cancer patients, or for that matter, even a solid tumor patient. So those are concerns. These things are still evolving, but in the present day, we still consider giving vaccination to all our patients because it is definitely emerging that vaccination has reduced the intensity of infections and made them less severe and less compromising in terms of complications. I mean, in terms of complications that develop in these patients, it's been far lower for those who have been vaccinated.
All right. Dr. Harish, how is the screening of cancer patients being impacted? You know, many patients have gone through for teleconsultations because they feel it's safer. But for cancer patients, sometimes you cannot put off a screening requirement. And some people are hesitant of stepping into imaging centers because those are being frequently used by COVID patients for, CT scans, etc. So has the screening of cancer been affected due to the pandemic?
Well, screening has always been underutilized in our country, especially screening for cancers. If we compare with the Western countries, let's say for breast cancer. Now, the patients who are diagnosed in stage 1 breast cancer in Western countries, let's say around 80% of the cancers detected are in early stage 1, stage 2 tumor. Whereas in our country, 80% of breast cancers are diagnosed in stage 3 or stage 4. So that is where we are. So as such, screening was underutilized in our country. And the pandemic has definitely affected cancer screening much more than how it was. Um, so basically, there has been a standoff with the, especially with the imaging services being utilized extensively for COVID infections. The screening was almost stopped for quite long period of time. So it has definitely got ramifications and implications. One thing is, what we are now seeing is more patients who are coming are at an advanced stage, the, possibly because of the non-availability of earlier diagnosis due to the absence of all these imaging facilities. And what are the implication of this screening is only we are going to see after, let us say, 5 years or 10 years from now on. Now, there have been studies in the Western literature which says that in next 10 years, there is approximately 10,000 excess deaths they are predicting in America just because they had to stop screening for a few months. So that is the magnitude of a difference screening for cancers makes. Of course, in our country, it's difficult to put a number to what is going to happen. We don't know, but definitely the screening of cancer has been affected, and we are more likely to see the implications in the coming years. And even the early stage tumors, which are otherwise diagnosed by some imaging, which the patient goes with some non-specific complaints, and they get some scans done, and they just pick up underlying cancers. Even such things where they could identify at an earlier stage has come down, and it has impacted. So there are many cancers which can be screen detected. For example, breast cancers, which before it becomes apparent to the patient, can be screen detected. Then there are cervical cancers which are screened. Then lung cancers, especially in smokers, and routine oral examination. The dentists had almost stopped for more than 6 months to 1 year. So there are a lot of oral cancers which would have been otherwise picked at an earlier stage, was also missed. So we are definitely going to see a lot of impact in the coming years regarding it has got implications even in the outcomes of the disease. So yes, the screening has been affected, and it is likely to these are all what do we say, immeasurable. We cannot measure it as of now, but in the next few years we are likely to see some of these missed cancers coming at an advanced stage. That is a real danger that we do have now.
That would be a real shame if people are, not seeking the right treatment, and the imaging is not happening, and they're coming in for treatment late. Late diagnosis of cancer really affects the outcome, the recovery, everything. So that will be a real shame. Dr. Prasad, in some of the hospitals, it is a practice, it is an SOP that you have to get COVID test done for any of the ongoing chronic care treatment. So should cancer patients get tested for COVID?
Yeah, it's a very good question, actually. So asymptomatic testing hasn't translated into much outcome, actually, in terms of diagnosing or anything, or complicated patients. So it is in best this thing of the patient safety, that in certain situations where a particular kind of treatment, if it is likely to be of great significance, or it can give more trouble to a patient who is having existing COVID infection, I think those patients definitely need to get tested. Like, for example, patients going through major surgeries, there is very strong data to suggest that if you are diagnosed with COVID immediately post surgery, the surgical outcome is not that great. So there are certain situations where we do we suggest to get a COVID test done before doing certain procedures, but asymptomatic testing is not something which is recommended now. And some of the cancer treatments also can can and should be given regardless of the patient having COVID infection. So that is what I would say. There is no one standard guideline, and the guidelines keep on changing, as I said, with more and more awareness that we have. The kind of COVID test also that we had before and what we are having now is totally different. We can get a COVID test result in few hours now from what we used to have. We used to take 3 days to get a COVID test result. So it has been a learning curve in terms of the testing also, not only in cancer patients, but for all other cases also.
Dr. Harish, first you have tests, like if you're going in for a surgery, we also heard about how imaging may not be happening, as much as it should to detect cancer early. Has the pandemic changed the healthcare delivery model itself, Dr. Harish? Has healthcare delivery changed because of the COVID pandemic?
I would say that it was shaken for some time, but I think as we go along the way with a better understanding of the pandemic, I think we have now settled down into delivering the treatment that is required for a particular patient in the same way that we were doing before the COVID times. So there was this always this perception that cancer patients are more at risk to succumb if they were to develop a COVID infection, but they would succumb even if they were not treated properly, depending upon the. So from that perspective, I don't think there was an alterations in the treatment that were, for example, some of the treatments that we would have otherwise offered regularly, which we thought might be immunosuppressive, we deliberately withheld them, thinking that that might have an adverse outcome with these patients. But that has actually changed very quickly after last year, and this year there has been really no change. And for all those patients who came to us seeking treatment for cancer, the same kind of treatment was offered to them as was required for that particular patient, which also includes stem cell transplants. I remember that when the COVID happened, there was in fact a recommendation from various organizations that we don't do any sort of intensive therapies such as transplants, etc. And we had actually shelved that quite a bit last year, but those things have completely changed this year, and we have carried on with doing transplants for patients as and when it was deemed required for that patient. So I think it has come down to being as it was before the COVID times as of now.
So, Mr. Ramu, the situation is quite dynamic, and how hospitals are responding to it is changing as you get more studies of, how the virus affects your body, etc. Now, in your hospital, were there many cancer patients who tested COVID positive? Was it a challenge taking care of them? How did you go about all of this?
Yeah, we did see a lot more volumes during the second wave as compared to the first wave. And I think because, as I mentioned, we were far more prepared because during the first wave itself, we had done a lot of things to get ready. I think we were able to handle that load. And as mentioned by Dr. Hari, I think we did not see an adverse difference between cancer patients and other patients who were getting affected by COVID. I think the management protocols at home, we had a home care protocol. A lot of our patients were offered services using video consultation so that they don't need to come to the hospital. We avoided unnecessary hospitalization and medications as well. And I think some of the over medications impact of that you're seeing now was something that our doctor teams actively managed well in terms of defining the protocols. We did have some patients who came into the ICU, but I must proudly say that all of them recovered. I mean, that's a fairly important statement to say that we had no fatalities, touch wood, of our cancer patients. And I think that goes to the credit to the teams, the oncologists, of course, were managing the care, the intensivists who were available when the patient was getting admitted in the ICU, as well as the home care protocols when they did not get admitted in the hospital. Overall, I think the communication that you need to take greater care during these pandemic times, and that they should avoid crowds, and is something that I think that adherence and compliance that we saw in our patients, I do believe has positively impacted the reduced number of cases as well. And now that the vaccine has become available, we have actively started vaccinating all our patients. I mean, so whenever they are coming for a consultation, or if not, we are scheduling follow-up meetings, follow-up consultations for them, and giving them the vaccine shots. So I think now we hope that even more the infection will not result in hospitalization or severe impact.
But it's really amazing to know that none of your IC patients, passed on. They recovered. This is really very heartening to know that they were not only fighting cancer, they were also fought the virus and won over. So that's really nice to know. Uh, uh, Dr. Menon, when it comes to caregivers of cancer patients, what measures should they follow so that they keep the cancer patients safe as well as not expose themselves?
So it is just that never let your guard down as far as in during this pandemic, because most of the time cancer patient is likely to remain indoors because of various reasons, not just because of the fact that there is a pandemic going on, but also by virtue of the fact that they are on treatment, they are probably a little less energetic to do any outdoor activities, etc. So much of the infections, etc., can be transmitted to the cancer patients from their own relatives who are not taking adequate care. So fundamentally, they need to take those precautions very diligently and consciously in terms of protecting themselves against getting an infection. So that is primarily the thing that we would say, because anyone is susceptible to because of the high infectivity rates of the virus. Anybody is susceptible to infection. So everything boils down to preventing an infection, and all measures that needs to be taken to decrease or mitigate the chances of transmitting an infection from a caregiver to a patient should be taken care of. Yes.
Yeah, and the risk should be minimized. Uh, Dr. Prasad, has the pandemic affected the clinical research programs at your hospital?
Yeah, very important question, specifically in oncology, because clinical research is where we find solution to all medical issues. The vaccine itself is a great example of how well clinical research can actually result in us getting our difficult situations. And oncology is a specialty where clinical research is important. Yesterday's treatment is not today's treatment, actually. So clinical research, it was affected in the initial period, definitely, because the research visits to the hospital are much more stringent than the usual visits usually, and there may be more blood tests which are required or other tests which are required. But we could manage a major part of that. I should say that our clinical trial patients, we could manage, for example, getting a waiver from the research, from the protocol regarding the blood collection period, or getting it done from home, and then getting the drug delivered home if it is an oral medication. All this is usually not a part of a clinical trial protocol, because clinical trial, even for an oral tablet, sometimes the patient has to come to the hospital to take. So we could manage it, but definitely clinical trial enrollment has taken a beating during this time. New patients being recruited has come down. So that will take some time for a reset. But ongoing trials, I think we could manage reasonably well. And I think in the second wave onwards, I don't think there has been a major change, because we have not restricted anybody or any patient who is coming in, and we have been able to deliver our clinical trial patients also the same way which we used to do before.
Right. Mr. Ramu, I want to talk about the other things Cytecare is doing other than caring extensively for the cancer patients, giving them great treatment, great care, getting all the protocols in place. I also want to talk about your CSR initiatives, where we know that you set up a step-down COVID care hospital in a school. Could you talk to us about this? You already have had your hands full with cancer patients at a very stressful time. So, what made you go ahead and step up, this COVID care facility?
As a cancer hospital, we had to keep Cytecare COVID safe, right? Can't be COVID free, but COVID safe. But we were seeing the number of cases all around us increase, and we said we have to do something. We can't take COVID patients inside Cytecare in the large numbers, but let's do something. And the whole team, the doctors, the management team, we had a conversation to say, what can we do during these times? And we have a foundation, Humanist Center for Medicine, that also wanted to do something in these times. So we said, let us raise about 5 crore rupees and do 2 major initiatives. One, we realized that moderately sick COVID patients forms the majority of those patients who are getting hospitalized and who need oxygen. And if you're able to take them out of a hospital setting and free up the hospital beds for those who are more severely sick, we would directly save lives. And these moderately sick patients really need oxygenated beds. So we set up a 120 bed step down COVID hospital in COVID in a school nearby called Canadian International School. The hostels were converted into a hospital within a 10-day. The hostels were converted into a hospital in about 10 days' time. And it has already saved a few hundred lives here, as well as because we saved hospital beds to be occupied by the more severe patients. The second initiative was to upgrade a local community hospital called Prakriya Hospital, because they were actually treating COVID positive patients in large numbers, but they did not have capacity. They needed about 100 more ward beds. They had the space, but they did not have the funds. So we collected funds for them to create a 100-bedded ward there and 10-bedded ICU with ventilators. So we facilitated that entire process. And again, I think we're very proud that a lot of lives were saved in this process. And I must say, the entire team worked very hard. So it also brought a lot of us together. And I think, as I keep saying, it was not only what we gave, but we got back a lot more than what we gave.
But Mr. Ramu, the pandemic is a tough time, not just for families as well. So what initiatives did you take to keep them motivated as well? Because, you have a cancer patient at home, you're scared for your health, sometimes you just want to give up. So what initiatives did you take to motivate the family to keep the, momentum on with the treatment?
I think fear was one of the biggest issues that we faced. Fear everywhere, right? We don't know, the fear of the unknown, what can happen, So I think, first of all, counseling, making it easier for people to travel, extra vehicles, ambulances, making sure that e-passes are given during the lockdown. So the fear factor of, can I do it? Am I available? Can I reach the doctor in time, etc. All of that we needed to reduce. The fear of getting the infection. What if the family members, transmit to their loved ones who are cancer patients? There was a lot of this guilt or the risk or, the feeling of possibility of guilt. So I think psycho-oncology, counseling played an enormous role. And the fact that people became more and more comfortable to do these sessions via video calls allowed greater access. I must say, at this point of time, even for our nurses and doctors, having availability of video consultations for them as well as their family members was something that helped us keep us going, because we needed to be sure that we have availability. So I think motivation from making sure that there is no need for fear, but just following the right protocols, I think made a huge difference for our patients and their family members. So there was mind-body wellness programs, there was yoga sessions that were being conducted, and navigators. Dr. Prasad had mentioned that we have navigators who are cancer survivors, and there was a program launched because they could not visit the hospital. The navigators themselves are cancer patients, as I say, in their past. So they wouldn't, we didn't want them to be coming to the hospital. So we said, why don't you start calling and doing video calls with our patients, wishing them maybe on their birthdays or on special occasions, and trying to be connected with our community. So a lot of these initiatives which were there suddenly became more online, virtual, and more accessible, in fact, for those even who were not locally present. So I think that has really helped our families of the patients.
Right. We're coming towards the close, but I do want to talk about the vaccination bit because I believe Cytecare has been doing vaccination camps. So I wanted to ask Dr. Menon, what importance do you attach to vaccination? How critical is it for cancer patients? Are you making special arrangements to vaccinate cancer patients?
So there was a lot of skepticism as Narayan also spoke to you about. There was a lot of skepticism when vaccination came into the picture. But if you, from a perspective of science, there is clearly no doubt about the fact that any sort of vaccination, especially in viral infections, have shown responses in terms of mitigating the intensity of infection and sometimes even preventing infections. So it was certainly the way to go ahead. But the problem that we had as far as COVID was concerned, there was no precedence or there was no real clinical trial which was conducted, or even if the data that was available was very scant for us to take decisions on the efficacy of these vaccines. So we were in a tight corner as far as that was concerned. And so, but we also knew that from a scientific perspective that taking a vaccination is important. So that's how, when it was brought on for the healthcare workers, though there was some reluctance among many of the health workers, we as a community went forward and took the vaccines without a problem. And I firmly believe that we could go through the second wave, which was much more intensive, only because of vaccination. And that has come through what we have experienced in terms of many patients and even individuals did get the viral infection despite the vaccination, but they did not have to get admitted or did suffer any sort of very adverse events because of the infection, and they went back home without a problem. So it was definitely protective. So from that perspective, there was a greater credibility to the fact that you need to take vaccination because it mitigates the intensity of infection. So that has been translated into advising our patients to take vaccines, though we know that many of our patients may not mount the same kind of a response to a vaccine. But I think it is important to take a vaccine because even some amount of antibody generation is important enough to decrease the intensity of infection. So from that perspective, we have always advised all of our patients to take the vaccine.
All right. So I'll take the last word from all of you, and I'd request you to keep it short. Mr. Ramu, what is your key takeaway message from the pandemic?
I would say be ready for change, embrace change, use change to innovate and reinvent yourself.
Okay. And Dr. Menon, your key takeaway?
So it's always good to bounce back. You may be hit with anything, but it's always good to bounce back. And then you know that everything will pass. Yeah, this is also something that we need to go through it. We do understand that we are not out of it yet, but this will also pass in due course of time.
Right. Dr. Harish, your key takeaway?
I would say trust modern medicine. Vaccines are one of the greatest inventions of humankind. And when Ramu said that we have had no mortality in hospital, I think the greater part of it goes to being the early vaccinators. As soon as the vaccines were available, most of the hospital within the first week, everyone were vaccinated. And even for our patients, we did ask them to get vaccinated as early as possible. So that is the thing. Trust modern medicine, and also for a general cancer patients are not excessively. What do we say? They are not in a high risk people. We say even those patients who have cancers, even if they do get COVID, they do very well. It's not like something to be very worried about. That's what I would say.
Okay, Dr. Prasad, your key takeaway.
I think most of the things everybody has said. So my takeaway is that be humble, learn from what you see, and I think that is what a true scientist always does actually. So this is all consider this as an opportunity and then learn from that. That is what I would say.
I want to thank all of you for taking the time coming here for this session and sharing with us the wealth of your knowledge, your experience, and your nuggets of advice to all the cancer patients on how to fight cancer, fight the pandemic, and come out on top. Dr. Menon, Dr. Prasad, Dr. Harish, Mr. Ramu, thank you so much for joining us this afternoon, talking to us about the superlative work being done by Cytecare Cancer Hospital to offer the best treatment options to cancer patients.